Hi, this is Andrew Merritt again, and today we have a different topic on our hands. We're going to talk about protein, nutrition, and optimization around surgery. Frankly, this is a topic that applies to pretty much everyone, all of our patients, and there's increasing information about protein needs as we go through life, and we're going to just hit on this, and this is relevant to every patient that I see, whether they're non-surgical, surgical, young, old, everywhere in between. So let's get after it. So we're going to talk about protein and creatine, and these mainly around the requirements as it relates to surgery, but you'll see it has to do with everybody. So first of all, we want to talk about what is protein. So we are frequently hear about in the news carbohydrates, fats, protein. These are the macronutrients. So a lot of information around carbohydrates, refined carbohydrates, high fructose corn syrup, all of these things. That's a whole different topic. I think it causes a lot of inflammation. I am pretty set on highly refined carbohydrates being bad for our joints, causing pain, but that's a completely different topic. There's also fats. We hear about it in heart disease. We hear about it in all sorts of stuff, but we're going to focus on this middle column, this protein. Okay, so protein is mostly can be from fruits or vegetables or meats. Typically, meats can be seen here combined with fats, as we see with cheese and eggs, combined with some carbohydrates like peas, beans, quinoa, things like that. But protein is ultimately the building blocks of life. Every part of our body uses this. As it relates to orthopedics, we're concerned about muscles, ligaments, bones, skin, healing from surgery. All of this requires protein intake to make the proteins in our body that fix or that make up all of the structures in our body that we care about for orthopedics, particularly muscle regrowth, bone health, fragility as we get older, healing of skin from our surgical incisions. So this is a very important part of life and of surgery. So the first thing that we need to know is that this has been very poorly disseminated to the population. The food guidelines, what we call the RDA guidelines, really kind of skipped over protein back in the day. So we've all seen these labels. It's on the back of every food. Protein down at the bottom here. And really the definition at that time was done by studies to identify essentially the minimum needed to sustain equilibrium or the minimum needed to sustain life. So it's a low end. It's not, we need to get out of our head ever thinking about this as optimum, okay? They did studies to see when does the body start, what level of intake of protein does the body start taking from its muscle to make the daily demands of protein to keep up your body's protein synthesis, okay? So at what lower level can we eat protein before it starts robbing our own muscles to find that protein, okay? So that is not optimum. We don't want to find that lower limit, especially in the surgical situation. We want to find the optimum, and that's what we're going to be talking about today. So this number is based on the percentage and the amount of protein that you should take. This is going to get complicated a little bit with some math, but I have some tables in here to show you. But 0.8 grams per kilogram of ideal body weight per day, okay? So what does that mean? If your ideal body weight is 100 kilograms, you should be taking about 80 grams of protein. That's their recommendation. We're going to talk about how that's not appropriate. So what is the problem? Well, in surgery, we need additional building blocks. We're restoring something. We need some, ACL reconstruction. We need to help make that ACL, total knee, total hip replacement, fracture surgery. We need to rebuild the muscles that's going to be injured as a result of this trauma. Oftentimes, afterwards, we're limiting your activity. We're not letting you weight bear. These break down the muscle. We need to trick the body into making more muscle or at least losing less. Additionally, surgery, there's a stress of the injury, stress on the surgery. We need to make more proteins so that we can overcome this. In addition, just in general in life, we want to be on the muscle building side of the equation. As we get older, we will start to lose muscle. That part of that is what we call anabolic resistance. So anabolic resistance is the resistance of the body to turn protein into muscle. Essentially, an older individual needs to do 2 times the amount of protein synthesis to make the same amount of muscle as a younger patient. So part of this is to trick the body, to flip the body into making muscle, making proteins when it's starting to not want to. That's anabolic resistance. So it really applies to everybody who's looking to not lose muscle or build muscle or overcome surgery. So you can clearly see minimal needed to sustain equilibrium is not appropriate in this. We want to be on the positive side of that. So what's the solution? Well, at least double the protein, okay? This is shown in lots of studies. The FDA is starting to identify this. They're starting to change those labels and identify protein as a more important macronutrient. So I made this table. There'll be some aspects of this where we talk about using ChatGPT or Gemini. This was made here, and it can quickly calculate this for you. But ideal body weight, so I have listed some ideal body weights, and then the recommended, so say our ideal body weight, mine is about 200. FDA would recommend 72. At least 145 is actually recommended. And we'll talk about why even higher than that. 2 grams per kilogram per day is better. But how do we calculate ideal body weight? Well, there's lots of fancy ways to do it. You can get DEXA scans and all of that. But easier way is, think back for me when I used to be in shape, high school, about the same height, muscular build. What did I weigh? I weighed 200 pounds. That's probably for my frame about right. So we can, when I talk to patients, we can always, think back of, oh, I didn't always used to look like this. I used to be fit and trim. And what was that body weight? Let's just use that as the ideal body weight. You can, again, get fancy, but let's just get the concept here. That's our ideal body weight. So find the ideal body weight, calculate the amount of protein that you should have. You will find when doing this math, it's very hard to meet that just by normal intake, especially in the surgical time period, especially as we get older when we need to trick our body into this. So there's a lot we're going to focus on is protein supplementation, protein shakes. You see them everywhere these days. You see the big 5-pound bags at Costco. You see the little drinks in the vending machine. So what are those protein supplementations? Well, there's 2 general categories: whey, which is a milk-based product, and plant-based. So we'll talk about the difference in general, and I'm not going to get into arguments of, vegetarian and animal, all of that sort of stuff. I'm not interested in that argument. If you can take whey and don't mind it, it's better for you. Why? Because it's a complete protein. It's animal-based. It has all of the amino acids, which is what makes up our protein. It has all of those to what we consider a complete protein. It's generally easier to drink, generally tastier. You don't need a blender. They're often just put in water. A big thing is leucine, okay? If there's one amino acid to learn, it's leucine. So proteins are made up of a lot of amino acids. One of those is leucine. Leucine is the trigger our body sees to start protein synthesis, start muscle synthesis, go that anabolic route, which means build up, not catabolic. It's the leucine. Leucine is that trigger, okay? There's a very high percentage, or proportionally higher percentage, of leucine in whey protein than in plant-based proteins. There's also great bioavailability of whey protein, which means you eat 25 grams, about 25 grams is getting into your body. It's not passing through, it's actually being absorbed. Plant-based protein can be done. There's lots of reasons why people might want that. Lactose intolerant or not interested in animal products. It is just factually an incomplete protein. It doesn't have all of the right mix that we use of the amino acids. It can be harder to mix. In my opinion, I've tried lots of them. It can be harder to mix to make it more palatable. There's lower leucine, so it has about half to two-thirds the amount of leucine, which is that trigger. And it's only about 60% to 80% bioavailable, meaning if you have to ingest 35 to 40 grams of drinking this protein to get 25 actually absorbed. So we have to take that into the consideration when we factor in how much protein to take. So you need about 50% more if you're using a plant-based protein supplement. So I made an example meal plan. Again, this is great for a ChatGPT type of thing. You can type in your weight, you can say your target, but you can start to see this is an example meal plan. So starting with 3 eggs in the morning, and again, eggs are great in leucine. That's a good natural food for leucine to give you that trigger to make muscle. Grilled chicken for lunch, and cod or salmon for dinner. Of course, there's a lot of different varieties. This is just the idea. But even with this, to just get to 130 grams for a 180 pound person, supplement with 51 grams of protein. I just find it hard in my patients to get to this level of protein without some supplementation. I don't eat much meat. It's not a common thing for me for lunch. I generally skip breakfast. It's very hard for me to get to these numbers without some significant supplementation. This you can use ChatGPT type things to help you with making a meal plan. So what are the studies as it relates to surgeries that I do, orthopedic surgeries? So total knee replacement. So they did a study in the Journal of Nutrition, 40 grams of whey protein starting 2 weeks before surgery, extending 2 weeks after surgery. And they had the patients had significantly better walking speed and leg strength at the 3-month mark compared to the placebo group. The protein group preserved their functional mass, and the control group, we see this a lot, permanently lost it, okay? It's part of getting that trigger of your body, even though you're going through surgery, to continue to make muscle. This is very important. In ACL reconstruction surgery, they gave patients a supplement immediately after their rehab session, one that took protein with carbohydrates, one with just carbohydrates, and the protein group had significant hypertrophy, which is muscle growth, hypertrophy, bigger muscle in the healing leg. They specifically identified leucine additionally, which again is higher in the whey proteins, at about 3 grams per serving, which is about what you get with a double serving of typical whey protein supplementation, and because they identified that helps turn on that repair process. So in general, there's not a scenario where we should be taking the RDA recommended 0.8 grams per kilogram per day. There's not, no one in this world, unless you have some rare genetic thing that your doctor tells you not to take protein. But improved surgical outcomes, injury prevention and muscle building, just even without an orthopedic problem. Endurance athletes need more protein for recovery and for muscle building, especially in weight loss when you're trying to preserve muscle. When is this big? This is in the GLP-1s right now. So the injectable weight loss drugs are showing that we're losing not just fat, but a lot of muscle. In those patients, especially because appetite is suppressed, they don't want to be eating steak and chicken and all of these sorts of things to get their protein up. Supplementation is generally important and gets harder to meet these higher thresholds, but very important if you want to lose fat but not lose muscle. Aging and overcoming anabolic resistance. So tricking our body into using the protein that's there. So all of these things have one solution: take more protein. So the thought that I generally have is aim for 2 grams per kilogram per day, which I put the body weight in pounds just because this is the United States that I'm generally talking to here. And so this is what we use for pounds of ideal body weight, 2 grams. And why 2 grams? Well, it's very safe. Studies have shown up to 3 grams per kilogram per day. Good good safety profile. If for some reason you have a thing that your primary care doctor has told you to not take high protein foods, okay, follow their guidelines. I'm not overriding that. But general safety profile is extremely good for higher protein intake. So if you aim for 2 grams, some days you're going to be not able to meet that. You're going to only get to 1.2 or 1.5. Some days you may get to 2.2, totally safe. But then we're probably averaging around that 1.6 range if we're aiming for 2. And that's why I think get this number in your head, start to calculate what your normal diet is getting you. I bet you'll realize it's far below this, and start to consider some protein supplementation, especially before and after surgery, which is my main sort of reason for this video, is for my patients that are going through surgery. So find your ideal body weight. That's about the protein that you should be aiming for, realizing some days you're going to come up short, some days you're going to make it, and generally we need protein supplementation to get there. Lastly, creatine. More and more evidence is coming out about the benefits of creatine, not just for muscle recovery, but also for cognitive improvement and depression prevention, especially in females, we're finding. Lots of good studies coming out on this. It's also one of the safest supplements that's used in the world. Very low, essentially no downsides. The only thing that you do, tell your doctor when you're going to go get labs. It does bump up one of the labs that we check for kidney function, but it's not actually, it's just a similar molecule. It's not actually affecting your kidney function, but they may think that it is because it's higher if you don't tell them that you're taking the creatine. So how does creatine work? Well, it helps the energy balance and hydration in muscles. It helps the post-workout recovery and lowers muscle inflammation to speed that recovery along. All of these things are very good, again, in the surgical time frame. We used to recommend 5 grams per day. Now it's bumped up to 10 grams, especially for the cognitive improvements that are being discovered. This, I just mix it in with my shake, with my protein supplement shake. Get both 2 in 1. Really, any of the ones, you can buy this stuff for very cheap on Amazon. Big bags for low dollars. Essentially creatine monohydrate is the ones. The gummies don't, it's too much sugar, not enough creatine. It's not getting, the data is pretty mixed on those. Just old school creatine scoops work good as long as it's monohydrate and a reputable brand that doesn't have any sort of, has good quality control. And mix those two together and we're off to the races from surgical recovery. If you want to know more, a lot of this, Peter Attia, I listen to a lot. He's a longevity exercise specialist, but actually science-based, not voodoo-based. He is maniacal on protein and all the things that we just talked about. A lot of this comes from, he finally summarized, I listened to a lot of his podcasts, summarized into one podcast, all of this information from little snippets over the years. And so this was his podcast was released in October of 2025. It's on Apple Podcasts as well as Spotify. And is just a great review, essentially a lot of what I discussed here. And thank you. I hope this encourages you to increase that protein. This is very helpful in surgical recovery. One of the biggest things that we battle is muscle loss after injury or surgery. And one of the ways to trick the body into it is by having higher levels of protein and making the body do something with that protein, which is building muscle. So I hope you found this helpful. And as always, call or happy to see you in clinic if needed. Talk to you soon.